Good afternoon, everyone. Bonjour tout le monde. Merci d'être avec nous aujourd'hui.
Thank you for being with us
Aujourd'hui,
today.
je suis accompagné
Today, I am
par la
accompanied
Dr Tam
by
et le
Dr.
Dr
Tam
New
and Dr.
et
New
mes collègues,
and
la
my
ministre
colleagues,
Hajdu
Minister
et la
Hajdu
ministre Anand.
and Minister Anand.
Depuis cette semaine,
As of this
plus
week,
de 50%
over
des Canadiens
50% of Canadians
admissibles ont
eligible
reçu leur
have
première
received
dose de
their first
vaccin
dose of
et beaucoup
vaccine,
d'autres
and many
recevront
others
leur
will
vaccin dans les
receive their
semaines
vaccine
à venir.
in the coming weeks.
As of this week, more than 50% of eligible Canadians have received their first dose of vaccine, and many more will be getting their vaccine in the coming weeks. This is good news, and when it's your turn to get vaccinated, please do so. I would now like to turn to my colleague, the Health Minister, Patty Hajdu. Patty?
Merci, Dominic, and good afternoon, everybody. As we end a week of appreciation for nurses, I first want to start by saying a profound thank you to everyone nursing across the country. I've had amazing conversations all week with nurses that are nursing in public health and primary care, doing research, supporting people all across this country. And I want to thank every single nurse for caring for our close ones and for the sacrifices that you're making every day, especially during this time of this extraordinary public health challenge. Like all Canadians, I look forward to the day where in my community of Thunder Bay, Ontario, we do get back to a normal life. But we all know we still have work to do to get there. So today, I'll share with Canadians that we have published a roadmap discussed with all the provinces and territories that will guide us as we ease our restrictions. Dr. Tam et Dr. New pourront en parler plus en détail dans
Dr.
quelques
Tam and
instants.
Dr. New can
Mais
elaborate
voici un aperçu
shortly,
des
but here's an
indicateurs
overview
à
of the
suivre avant
indicators
de réduire les
to
mesures
follow
de santé
before
publique.
we
La
loosen public
transmission
health
de la
measures.
COVID-19
Transmission
est
of
contrôlée à un
COVID-19
niveau gérable.
would be at a
La
manageable
capacité
level.
du système de santé
The
publique est
public
suffisante
healthcare
pour
system
tester,
would be
retracer,
sufficient
isoler
for
et mettre
testing,
en
tracing,
quarantaine une
isolating,
forte
and
proportion de
quarantining
cas et de
a
personnes
strong
qui
percentage
ont
of
été en
cases
contact
and
avec des
people who
personnes
have been
infectées.
in contact with
Il
infected
existe une
people.
capacité suffisante
There
en
would be enough
matière de soins de
capacity
santé pour réagir aux flambées.
in healthcare
Et des
for
mesures de
outbreaks,
réduction de risques sont en
and
place
measures
pour la
for risk
population
reduction
vulnérable
would be in
et
place
dans
for
le milieu
vulnerable
à risque
people
élevé.
and those who are
As
at
more
elevated
and more
risk.
Canadians are getting vaccinated, provinces and territories can use these guidelines to inform how and when specific measures should be eased. And here's what that means for you. For now, you need to keep following public health advice, whether or not you've been vaccinated, to keep yourself, your family, and your community safe. More people need to be vaccinated before we can ease restrictions. And that's why I encourage you to reach out to help friends, family, neighbors, colleagues who might need help booking or getting to a vaccination appointment. For the summer, as Dr. Tam shared with Canadians, if 75% of us that are eligible for vaccines have one dose and 20% have had a second dose, we can start to see these restrictions be lifted based on public health situations in your area. You'll need to continue to follow the local public health advice and keep up with individual measures like physical distancing and wearing a mask indoors. But you can look forward to small outdoor gatherings with family and friends. And in the fall, if 75% of those eligible for vaccines have received a full COVID-19 vaccination series, then local public health could be able to lift even more measures. And we should be able to do more activities indoors with people outside of our household. We all have it in our power to increase our chances of having a safe summer, a better summer for everyone. So please continue to choose activities that present lower risks to you and to your family, and keep following public health advice to help your local public health unit get to a place where restrictions can be eased in your community. I want to thank every single Canadian who stepped up to get vaccinated when it's their turn. I too have joined you, and I am so proud of all of you who are taking that important step to save lives and stop the spread. Thank you. Merci.
Merci beaucoup, Patty. Alors, on va
Thank you
se
very
tourner
much, Patty.
maintenant vers notre
Now
collègue,
we will go to our
la
colleague,
ministre Anand.
Minister
So, Anita,
Anand.
over to you.
Thank you so much, Dom, and good afternoon, everyone. Today, I will provide an update on vaccine deliveries into Canada and milestones that we have reached. As of yesterday, more than 20 million doses of COVID-19 vaccines have arrived into this country. Canada is currently in the top G20 countries across a number of metrics, including total doses administered per capita, percentage of population that has received at least one dose, and average daily vaccination rates. In particular, 42% of all Canadians have had at least one dose of vaccine, and more than half of all Canadians who are adults have received at least one dose. In terms of individual suppliers, Pfizer is delivering 2 million doses per week this month and will deliver 2.4 million doses each week in June, constituting 5 deliveries in June alone. 42% de tous les Canadiens ont
42%
reçu au
of all
moins une
Canadians have
dose
received
et
at
plus
least
de la
one dose,
moitié des
and more than
adultes
half of all
canadiens
Canadian
ont
adults
reçu
have
au
received
moins une dose.
at least one dose.
Pfizer livre 2 millions de
Pfizer
doses
is
par
delivering
semaine
2
ce
million doses
mois-ci
per week
et
this month,
livrera
and will deliver
2,4 millions de doses
2.4 million more
supplémentaires par
doses
semaine en juin.
each week
In
in June.
fact, due to the upcoming Victoria Day holiday, Pfizer has agreed to deliver doses earlier by moving up a significant portion of the deliveries scheduled for the week of May 24th. So, next week, Canada will receive a total of 3.4 million Pfizer doses, 2 million arriving as scheduled early in the week, and 1.4 million doses arriving on Thursday and Friday ahead of the holiday weekend. The balance of the scheduled doses for the week of May 24th, approximately 600,000, will arrive shortly after the holiday Monday. Combined with the upcoming delivery of 1.1 million Moderna doses next week, Canada will be receiving 4.5 million doses in total next week. To repeat, 4.5 million doses of Pfizer and Moderna are arriving to Canada next week. We are continuing negotiations with our suppliers to accelerate deliveries so that the provinces and territories can get vaccines into the arms of Canadians as rapidly as possible. Across the country, we are seeing provinces and territories expanding the groups eligible to book a vaccine. Le gouvernement continuera de travailler sans
The government
relâche
will continue to work
jusqu'à
around the
ce
clock
que tous les
until every
Canadiens qui
Canadian
souhaitent
who
être
wants a
vaccinés le
vaccine
soient.
has one.
The government will continue to work to bring millions of vaccines to this country for all Canadians. This is my goal and sole focus, and I will not relent as we all recognize the importance of having enough vaccines for all Canadians. Thank you. Merci. Miigwech.
Thanks very much, Anita. We're now going to turn to Dr. Tam and then to Dr. New. Theresa.
Bonjour à toutes et à tous. On a national level, we're seeing hopeful signs that we've passed the peak of the third wave. The latest 7-day moving average of daily case counts is more than 20% lower than the peak in April, dropping to less than 7,000 cases daily for the first time since early April. We're also beginning to see reductions in the number of people experiencing severe and critical illness, with less than 4,000 people with COVID-19 being treated in our hospitals each day, including less than 1,400 in intensive care, and an average of 48 deaths being reported daily. This is important progress, but the numbers are still too high. We must drive infection rates down much lower while getting our vaccine rates as high as possible. To date, over 17 million COVID-19 vaccine doses have been administered across Canada. This is great news and improving every day. But we can't let go of the public health measures and individual precautions that are our essential safety ropes to prevent another resurgence on this tricky path. As our modeling shows, by maintaining control measures until at least 75% of eligible adults have received a first dose of a COVID-19 vaccine, and at least 20% of them have had their second dose, we would drive infection rates low enough and raise vaccine protection high enough to allow for lifting of restrictions without overwhelming health systems. But one dose of a two-dose vaccine series is not enough to maximize protection. We need to aim for at least 75% of everyone who is eligible for vaccination getting fully vaccinated. And we can't go halfway. So it is very important to get that second dose. The good news is that our first target is within sight. 4 weeks ago, less than 25% of adults had received at least one dose of COVID-19 vaccine, and now we're at just over 50%. This month, with significant increases in vaccine supply, ramping up of vaccination programs, and Canadians coming forward, as well as encouraging others, we're making great strides and can look forward to enjoying an outdoor summer that gets us back into many of the activities we've been missing. In very general terms, this means we'll be able to get back to small outdoor gatherings with family and friends, camping, outdoor sports, small reunions at picnics, parks, and patios will begin to bring us together in person again. We will still have to follow local public health advice and keep up with individual measures, like physical distancing and wearing a mask as recommended. Heading into the fall, as more and more Canadians get fully vaccinated, giving us broader protection across our communities, we'll be able to look forward to moving indoors together. This would mean getting back to indoor work, in-person learning at colleges and universities, and recreational activities, as well as finally being able to get back to the in-person multi-household celebrations and holidays we've been longing for. To get to this better summer and fall, we need to keep doing everything we can to protect ourselves and our communities, ease the pressure on the health system, and help bring an end to this pandemic. This includes rolling up your sleeves to get vaccinated as soon as you are able. Thank you.
Bonjour à toutes et à tous. À l'échelle nationale, nous décelons des
Hello,
signes
everyone.
encourageants que nous avons
On a
franchi
national
le pic
level,
de la
we're seeing
troisième vague.
hopeful signs that we've
La
passed the
dernière
peak of
moyenne
the
mobile
third
sur 7
wave.
jours, le
The
nombre de
latest
cas quotidiens
7-day moving
est plus
average
de
of daily
20%
case count
inférieur
is
au
more than
pic d'avril
20% lower
et
than the peak in
s'établit à moins de
April,
7 000 cas
dropping to
quotidiens
fewer
pour la
than
première fois
7,000
depuis
cases
le début
daily for
d'avril.
the first time since early
Nous
April.
commençons aussi
We
à
are also
enregistrer
beginning
une
to see
réduction du
reductions
nombre de
in the
personnes qui
number of
tombent
people
gravement malades
experiencing
ou se
severe
retrouvent dans un
and
état
critical
critique,
illness,
car moins de
with
4 000
fewer than
personnes atteintes
4,000
de la
people with
COVID-19 ont été
COVID-19
traitées dans nos
being
hôpitaux
treated in
chaque
our
jour,
hospitals
y
each day,
compris moins de
including fewer
1
than
400 qui ont été
1,400
traités aux
in
soins
intensive
intensifs
care,
et
and an
48
average
décès
of
étaient
48
signalés
deaths
en
being
moyenne chaque
reported
jour.
daily.
C'est une
This is
amélioration
important
marquée,
progress,
mais le nombre
but
de
the
cas est
numbers are
toujours
still
trop
too
élevé.
high.
Nous devons réduire
We
bien
must
plus
drive
les taux
infection
d'infection
rates down
tout
much
en faisant
lower
grimper les taux
while
de
getting our
vaccination le
vaccination
plus haut
rates as
possible.
high as possible.
À ce jour,
To
plus de
date,
17
over
millions de doses
17
de
million
vaccins contre la
COVID-19 vaccine
COVID-19
doses
ont été
have been
administrés dans
administered
tout le
across
pays.
Canada.
C'est une excellente
This
nouvelle
is
et la
great news
situation
and improving every day,
s'améliore de jour en jour.
but we
Mais nous ne
can't let
pouvons
go
pas nous
of the
passer
public
des
health
mesures de
measures
santé
and
publique
individual
et délaisser
precautions
les mesures de
that are
prévention
our
individuelles
essential
qui sont
safety
les
ropes
balises à
to
respecter pour
prevent
éviter
another
une autre
resurgence
recrudescence de
on
cette
this tricky
crise.
path.
Comme le montrent nos travaux
As our
de
modeling
modélisation,
shows,
c'est en
by
maintenant les
maintaining
mesures de
control
contrôle
measures until
jusqu'à ce
at
qu'au
least
moins 75
75%
des
of
adultes
eligible
admissibles
adults
aient
have
reçu une
received a
première dose de
first
vaccin
dose
contre la
of a
COVID-19
COVID-19
et qu'au moins
vaccine, and at
20%
least 20%
d'entre
of
eux
these
ont
have had their
reçu une
second dose,
seconde que nous pourrons
we would
abaisser
drive
suffisamment
infection
les
rates
taux
low
d'infection
enough and
et
raise vaccine
augmenter
protection high enough
suffisamment la couverture vaccinale pour
to
pouvoir
allow
lever
for
les
lifting of
restrictions
restrictions
sans
without
surcharger la
overwhelming
capacité
health
de notre
systems.
système de santé. Or,
But
une dose
one
de
dose
vaccin
of a
sur une série
two-dose
de 2
vaccine
ne suffit
series
pas
is
à
not enough to
maximiser la
maximize
protection.
protection.
Nous devons avoir comme
We need to
objectif
aim for
au
at
moins
least
75% de toutes les
75% of
personnes
everyone who is
admissibles
eligible
à la
for vaccination
soient
getting fully
entièrement
vaccinated.
vaccinés. Nous ne pouvons
And we
faire les
can't
choses à
go
moitié,
halfway,
donc il
so it
est
is
très
very
important
important
de
to get that
recevoir la
second dose.
seconde dose. La bonne nouvelle,
The good
c'est
news
que
is that
notre
our first
premier
target
objectif
is within
est en
sight.
vue. Il y a 4
4
semaines,
weeks ago,
moins de
fewer than
25% des
25%
adultes
of
avaient
adults
reçu au
had
moins une
received
dose d'un
at
vaccin
least one
contre le
dose of a
COVID-19
COVID-19
et nous
vaccine,
atteignons maintenant
and now we're at
presque
almost
les
50%.
50%. Ce mois-ci, grâce à l'augmentation
This month,
importante
with
de
significant
l'approvisionnement
increases
en
in
vaccins
vaccine
et
supply,
l'intensification de la
ramping up of
campagne de
vaccination
vaccination
programs,
et des
and
Canadiens
Canadians
qui
coming
ont
forward,
répondu
as
à
well as
l'appel et
encouraging
ont
others,
encouragé les autres, nous faisons
we are making
énormément de
great
progrès
strides
et nous
and can
pouvons
look forward to
envisager
enjoying
un
an
été à
outdoor summer
l'extérieur
that
où
gets
nous
us back
exerçons
into many
de
of the
nouveau un bon
activities
nombre des
we've been missing.
activités que nous ont manquées. De façon très
In
générale,
very
cela
general terms,
signifie que
this
nous
means
pourrons
we will
organiser de
be
petits
able to get back
rassemblements
to
à
small outdoor
l'extérieur
gatherings
avec nos
with
proches et
family
nos
and
amis,
friends,
grâce au camping, au
camping,
sport
outdoor
d'extérieur
sports,
et à des petits
and small
rassemblements
reunions
lors
at
d'un
picnics,
pique-nique dans
parks,
les
and
parcs ou sur les
patios
terrasses, nous
will
pourrons
begin to
être
bring us
ensemble à
together
nouveau
in
en
person
personne.
again.
Il nous faudra
We will
encore
still
suivre
have to
les conseils de
follow
santé
local
publique
public health
et
advice
continuer à
and
prendre
keep
des
up with
précautions
individual
individuelles
measures
comme la
like
distanciation
physical
physique et le
distancing
port de
and
masque
wearing a
au
mask
besoin.
as
À
recommended.
l'approche de l'automne,
Heading
au
into the
moment
fall,
où de plus en
as
plus de
more and more
Canadiens seront
Canadians get fully
entièrement vaccinés,
vaccinated,
ce qui nous
giving us
offrira une
broader
meilleure
protection
protection dans
across our
l'ensemble de nos
communities,
communautés, nous
we will
pourrons
be able to
songer à
look
nous
forward
retrouver
to
à
moving
l'intérieur.
indoors together.
Cela signifie la reprise du
This would mean
travail
getting
et
back
des
to indoor
activités
work,
récréatives à l'intérieur,
in-person
le
learning at
retour à
colleges and
l'apprentissage en personne
universities,
dans les collèges et les
and recreational
universités, ainsi
activities,
que les célébrations et
as
les
well
fêtes
as
en
finally being
personne
able to get
avec
back to
plusieurs
the
familles que
in-person,
nous attendons
multi-household
depuis longtemps.
celebrations and holidays we've longed
Pour
for.
que cet été, cet automne espéré
To
se
get to this
concrétise,
better
nous
summer and
devrons
fall,
continuer à
we
faire
need to
tout
keep
en
doing
notre
everything
pouvoir
we
pour
can to
nous
protect
protéger
ourselves
et
and our
protéger notre
communities,
communauté.
ease the pressure on the system. The video has frozen.
It looks like Dr. New has gone off the.
Alors, peut-être on va commencer avec les questions maintenant. Nous allons maintenant prendre les questions.
We will now move to
On a
questions.
environ
have
30
about
minutes.
30
We'll now
minutes.
take questions, and we have about 30 minutes. Do one question, one follow-up. I'll pass it over to the operator to take the first question. Je vais maintenant passer la parole à l'opérateur pour la première question.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, la première question. Marie Vastel, Le Devoir. Your line is open. À vous la parole.
Oui, bonjour. En fait, ma question est pour vous, Monsieur Leblanc.
My
C'est
question
sur un
is for
autre
you, Mr.
sujet,
Leblanc,
si vous
on another
permettez.
topic, if I may.
Hier, le gouvernement du Québec
Yesterday,
a
the
déposé
government
sa
of Quebec
réforme de la
tabled
loi
its
101, comme vous
reform
le
of Bill
savez
101,
certainement.
as you
Le
surely
gouvernement a
know.
annoncé qu'ils
The
vont
government announced
notamment modifier
that they
la
will be
Constitution pour
amending the
inscrire
Constitution
que le Québec est une nation
to
et
say
que le
that Quebec
français est
is a
la seule langue
nation
officielle.
and that
Je
French
voulais
is the only
savoir,
official language.
est-ce que le gouvernement fédéral est aussi
Is
d'avis
the
qu'une
federal
province
government
peut modifier
of
cette section
does it agree
provinciale de la
that
Constitution
a
de façon
province
unilatérale?
can modify the
Quelle
Constitution
interprétation
unilaterally?
est-ce qu'Ottawa a
What
des
does
amendements
Ottawa think
possibles
of
à faire?
possible amendments?
Marie, merci
Answer.
pour la question.
Marie,
J'ai,
thank you
comme
for the
tout le monde,
question.
pris connaissance de
I
ces
became aware
propositions seulement
of that
hier.
proposal yesterday, like everyone
J'ai
else.
l'intention, j'espère, en fin de semaine, de
Over the
parler à
weekend,
ma
I hope to
collègue, la
speak to
ministre
my
Lebel,
colleague, Minister Lebel,
Sonia Lebel du Québec.
Sonia
J'ai pas
Lebel
encore
of
eu cette
Quebec.
chance-là.
I haven't had that
Et
opportunity yet.
moi, j'ai pas eu, et le gouvernement n'a pas eu à date,
The government
par exemple,
hasn't
les
yet
avis de M.
received
Lametti, le ministre de la
guidance from
Justice, ou
Mr.
évidemment
Lametti,
notre collègue,
the
Mme
Justice
Joly,
Minister,
ministre responsable pour les langues officielles. Alors,
or
moi, j'ai
Minister
pas de
Joly, the official
commentaires à
languages
faire à ce
minister,
sujet
so I
aujourd'hui.
don't
On
have any
aura dans les
comments on
jours
that today.
à venir, évidemment,
In the
quelque
coming
chose de plus
days,
substantiel à
we'll have
dire.
something more substantial to say.
Est-ce que vous avez commandé des
Question.
avis légaux
Have you asked for
au
legal
ministère de la
advice
Justice ou autre?
from the
Et
Department
est-ce
of
que vous
Justice or others?
craignez, sans vous prononcer sur la
And without
constitutionnalité d'un amendement
talking
constitutionnel,
about
mais est-ce que vous craignez
the sound quality
que
does
ça
not allow
puisse
for the
ouvrir
interpretation of
une
this
boîte de
question.
Pandore et mener d'autres provinces ou des groupes autochtones à vouloir emboîter le pas à Québec et faire leur propre demande constitutionnelle?
Comme vous savez,
Answer. As you know,
notre gouvernement,
our
la
government,
ministre responsable,
the
Madame
minister
Joly, mais le
responsible,
gouvernement
Minister
a
Joly,
a
but the
publié
government
un
has
livre
published
blanc, un
a white
document
book,
qui
a
détaille,
document
je pense,
detailing
des améliorations, des
improvements,
modernisations de la loi
modernizations
fédérale
of the
sur les langues
Federal
officielles.
Official Languages Act.
C'est un document que moi j'ai
It's a
trouvé
document
parfaitement
that I
approprié,
found
qui a
perfectly
eu
appropriate
au moins en Acadie, mais dans d'autres
in
régions du pays,
Acadie and in
une
other regions of the
réception assez
country.
positive.
It was pretty
Et
well
ça demeure le
received,
focus pour notre
and that's the
gouvernement. On est
focus
en
for
train
our
de regarder
government.
les questions en termes
We're looking
de projets de loi
at bills
qui vont faire suite évidemment
that would follow,
au document que
that would
Mme
follow the
Joly
document
a rendu public il y a
published
déjà un
by
couple de mois.
Minister Joly a
Alors,
couple of
ça
months
demeure le
ago.
focus pour notre
So that's the
gouvernement et
focus for
dans
our government.
les prochains jours ou les prochaines
And
semaines,
in the coming
mes
days and
collègues auront
weeks,
peut-être quelque
my
chose à dire
colleagues
quant
may
aux
have something
propositions
to
du
say
gouvernement du Québec.
about
Mais pour
the
le moment,
government of
moi,
Quebec's
personnellement,
proposals,
j'ai
but
pas eu la
personally,
chance
I haven't yet
d'être
had the
vraiment briefé
opportunity
sur
to
ces
really be
questions-là
briefed
et
on these questions.
j'aventurerai pas sur des commentaires précis
And I
et n'ayant
won't
pas eu
make
la
any
chance
specific
d'avoir ces
comments.
discussions-là avec mes collègues.
I haven't yet had those discussions with my colleagues.
Prochaine question.
Thank you. Merci. La prochaine question. Mia Rabson, the Canadian Press. Votre ligne est ouverte. Please go ahead.
Yeah, hi. My first question is for Dr. Tam. I'm wondering if you could talk a little bit about this return to more normal life and these markers, 75% and 25%. What happens if we don't meet them, and why are they so much higher than what we've seen in other countries? The UK, for example, about half have one dose and about a quarter have both doses. And next week, they're widely opening up much more than you suggest. We will be even at 75 and 25. So I'm just wondering why we're setting the bar so high and what happens if we don't meet those bars.
Yeah, so these are modeling projections about what could happen and with lots of different parameters, assumptions to fill in. But I think having an aspirational target is really a good thing for everyone to aim for. En route to that target, provinces and territories will have to take into account the epidemiologic picture primarily. The UK, if you sort of look back at their epidemic trajectory, they crashed that curve, that very massive third wave, to very low levels by the time they got to that kind of vaccine coverage. You need to look at both of those parameters. At this point in time, provinces might be reaching some of these vaccine coverage levels that the UK was seeing when they were lifting, but the epidemiologic picture is completely different. We're still just beginning to peak on this third wave in many different provinces and territories. So what we've done is we've also published some indicators on top of those vaccine targets, because you have to actually let the epidemiology and the data drive the slow reopening measures at the local level. So some of these indicators on top of these targets of vaccine coverage includes looking at your transmission indicators. So if your transmission is controlled in terms of COVID-19, that includes forecasts and reproduction numbers. That includes sufficient testing, tracing, isolation capacity so that you can detect resurgences and do something about them. It includes looking at hospital and other health care capacities before you can safely reopen slowly, staged, and in a sort of thoughtful manner. And so your vaccines will help, will be a major help in helping keep your rates low and point towards a future that includes some of these activities that we've longed for without resurgences happening. And by the way, there's the estimates that we provided, like 75% first dose, 20% second dose, is modeled upon the kind of rates you should aim for if you don't want your resurgences to overwhelm your hospital systems again. That's what that number is for. And so I don't know if that answers your question, but it really is a combination of indicators that people should be looking at, but really important for Canadians to have something to look forward to. And these are aspirational targets.
Be a follow-up?
Yeah, thank you. My next question, I'm not sure who wants to answer this one, but we received 655,000 doses of AstraZeneca from COVAX yesterday. For now, they're sitting in freezers. There are countries all over the world who would maybe desperately want these vaccines and would use them today. Why did we accept these doses if we're not going to make sure that they're going to get into arms and not sit in freezers?
Maybe I can start. It's Patty Hajdu. Well, I think the premise of the question is a little bit askew because, in fact, there's no indication yet that provinces won't be using AstraZeneca for second doses. And so we're working with them right now to determine their allocations and what provinces and territories will need to complete vaccinations for those people that have had the first dose of AstraZeneca. Obviously, we're monitoring this very closely, and my expectation is that doses of vaccine, regardless of the variety and type, don't go to waste. Perhaps, Dr. Tam, you want to add a little bit more about that?
Yes, so at the moment, in discussion with Chief Medical Officers of Health, broadly all across the country, they've halted any further administration of that first dose, and that any existing supply will go towards provision of the second dose for those who've had one dose already. Based on what I know is just over 2 million doses have been provided as the first dose. So I think this 655,000 would potentially go towards individuals who wish to have the AstraZeneca vaccine as a second dose. But you have a very good point, and I think we are waiting for the studies, including one certainly from the United Kingdom, to determine whether we can provide an mRNA vaccine as that second dose. And I think early indicators show that is a good option, but we're waiting for that data and for NACI to provide that recommendation. At that point in time, I think obviously there may be less people who would take up the AstraZeneca vaccine as a second dose, but is it important to still have that option right now? And of course, we need to evaluate the use, thoughtful and ethical use of the vaccines that we have in our country, and we shouldn't take any further doses that we can't use.
Okay, we'll take the next question, please.
Thank you. Merci. Our next question. La prochaine question, Raymond Filion, TVA. Your line is open. À vous la parole.
Merci, bonjour à tous.
Question.
J'aimerais savoir
Hello.
combien de
I'd
cas
like to know
actifs
how
du
many
variant
active
indien, le
cases of the Indian
B1617,
variant
on dénombre actuellement
are
au
there
Québec et en
currently in
Ontario,
Quebec
que ce
and
soit
in
des gens qui
Ontario,
habitent dans ces provinces
people who live in these
ou encore des
provinces
gens qui y sont soignés
or
actuellement.
people who are being treated?
Bon, merci pour la
Answer.
question.
Thank you for the question.
C'est Dr. New et je suis
Dr. New
reconnecté maintenant et désolé pour
Connected
les
again.
problèmes techniques
I
avant.
apologize for my technical
Mais
problems
on continue,
earlier.
je pense, avec toutes les provinces et
Along
territoires,
with all of the provinces
de faire la
and
surveillance
territories, we continue
pour juste les variants
to keep watch
préoccupants. Mais
for
à
variants
date,
of
moi,
concern, but
personnellement,
to date,
je n'ai pas
personally,
les chiffres
I don't
exacts,
have
le
the
nombre de
exact
personnes
numbers
atteintes
for the number
avec
of people
les variants. Je pense que c'est
who
quelque chose en
have the
évolution,
variants.
mais
I
je
think it's
pense
something
que
that's
pour moi, c'est pas vraiment une
always
question
changing. To me,
combien de
it's
cas de
not a
variants? On sait
question of
que
how
les
many
variants
cases of
peuvent être
variant.
plus transmissibles.
We
mais
know
je
that the variants can be
pense
more
que
transmissible.
en total qui est le plus important,
It cut
c'est
out.
un indicateur qu'est-ce qui se passe
It's an
à
indicator
l'échelle
of what's
locale avec la
happening
transmission
at the local
communautaire.
level with
Donc,
community
si c'est une
transmission.
variante ou ce n'est pas une variante
Whether it's a
préoccupante,
variant or
les mêmes
not,
principes
the
pour
same
la santé
principles
publique, les
apply
mesures de santé publique,
for
les
public health
précautions
measures
individuelles
and
que tout le
individual
monde
precautions.
doivent continuer à respecter
So people
et
need to
suivre.
continue
Ça
to
reste la même
respect
chose, mais
those
c'est sûr,
measures.
peut-être après, on peut peut-être
But perhaps
vous donner
later,
les
we
chiffres
can
plus
provide
exacts
the
selon les
exact
données
numbers
probantes que
based
nous
on the evidence
recevons des
that we
provinces et
receive
territoires.
from the
Je ne sais
provinces
pas si
and
Dr. Tam
territories.
peut-être
I don't
quelque
know
chose
if Dr.
d'autre
Tam has
ajouter.
anything to add.
Merci.
Thank you.
Okay. Oh, sorry. Go ahead.
Oui. Concernant le variant
Answer. Yes. Concerning the variant
B17, je pense que c'est ça la
167, I
question.
believe.
Donc, on a quelques systèmes
We have a few systems
pour le séquençage
for
de
sequencing
variants
the
maintenant.
variants now.
On a discuté avec
We've
le
discussed
laboratoire de provinciaux et
with
territoriaux
provincial and
pour
territorial labs
maintenant pour détecter cette
to
variant.
detect this variant.
Je peux dire qu'on a déjà le
I can say
détecté
that it's been
dans
detected
l'échantillon
in
de
sampling
voyageurs
from
qui est
travelers
dans la frontière
at the border.
internationale. Donc, on va avoir
So
des
from
chiffres
international
à
travelers,
bientôt
we'll have
concernant
numbers
cette
soon
variant. But
regarding that
just to
variant.
say that we have, now that this variant has been reclassified to a variant of concern, and we know that there have been some cases, because we're sequencing 100% of cases of the samples coming across for travelers. So we should have that data available but we'll have to get back to you on that one. And we know that there have been cases detected in provinces and territories, and there may be some early signs that we already have some community transmission. But as Dr. New has said, this variant shows increased transmissibility, a bit like the B117. We have not seen any data pertaining to the other attributes. It doesn't seem to impact our PCR diagnostics. It remains to be seen in terms of any impacts on vaccines and treatments. Some early antibody data shows that it may be, again, like the B117, there may be some diminished antibody response, but to the class covered by the vaccine, but the vaccines will provide protection. So, the similar measures will be taken to manage the transmission of this variant as we have for other variants.
Sweetie Ray?
So as a follow-up, So as a follow-up, Dr. Tam, and perhaps Minister Hajdu, if you have any information, feel free to jump in. Is there anyone with the B1617 variant from outside Ontario and Quebec who is currently getting medical care in those two provinces, to your knowledge?
I'm not aware. We don't have data as to the individuals, patients that are being treated, but I do know that B1617 has been detected in more than those two provinces.
Okay, next question.
Thank you. Merci. Our next question, Kevin Gallagher, CTV National News. Your line is open. À vous la parole.
Hello. Thank you for taking my question. I'm interested to know. So this summer, providing things go well with the 75-20% ratios, we could go camping, hiking, have picnics, patios, and outdoor gatherings. But I'm interested to know what's the difference between this one-dose summer and the no doses that we had last year, because it seems like all of those activities were things that people were being encouraged to do safely last summer. So I'd like to know sort of what's the benefit, what's the encouragement for people to go out and get vaccinated when it seems like the restrictions are pretty much the same as what we had when we had no vaccines last summer?
Can someone hear me?
Yes.
My video feed has just disappeared.
Oh,
I can hear
Theresa,
you.
we can see you, Theresa. Go ahead.
Okay. So I think individuals who got the vaccine should feel more confident, even with one dose, that they themselves have been better protected. That's the key about that one dose, but you've got to get that second dose to provide maximal protection. We do know that there's increasing data to show that these vaccines can reduce transmission, the mRNA vaccines, for example. So that is a good sign. But the majority of the population only have one dose of vaccine on board. And I think, so in general, you're essentially behaving like you haven't as yet got vaccinated. You're only halfway. So that's the general message is, to all intents and purposes, it may seem like last summer, you're going out on your patio, you're going outdoors. That's a really good thing. You should feel that you've got another extra layer of protection. What I would say is that it was very likely that throughout last summer, there were transmission and hidden chains of transmission that has occurred that would lead to a resurgence in the fall. In this summer, one would hope that with all on board, with the ongoing case detections, and we got to keep doing surveillance and trying to detect cases all throughout the summer in order to avoid any resurgence in the fall. So what's the differences between this summer and the previous one is that we stand a much better chance to having an outdoor summer that doesn't lead to a resurgence in an indoors fall. So that's more of a population health way of looking at things. But as an individual, you should feel much more confident if you've got any doses of vaccines on board that you yourself are better protected.
Dr. New, maybe I can just add a couple of points to what Dr. Tam said. I think maybe the two aspects which are maybe different this summer compared to last summer is that in many parts of the country, we're still battling the third wave, right? And so the case counts are high. The healthcare systems in certain parts of the country are still sort of close to the breaking point. So that's why we certainly have to be very careful. And of course, as just I think with the previous question, there's also the issue of circulating variants, right? Many of them have shown to be more transmissible. So in some ways, there's a less of a margin for error in terms of individual practices and how you may be able to protect yourself. So that's why I think even if we have optimism and hope that the vaccines are going to lead us out of this pandemic, we can't let up on the public health measures, and that's why we're optimistic and we want people to get vaccinated as soon as possible, recognizing that these two other factors are in play as well compared to last summer. Thank you.
Kevin, go ahead with your follow-up.
Right. Yesterday we saw from the U.S. So I'm just getting a little feedback there. That they released, mask guidelines that when Americans that are fully vaccinated don't have to wear masks, no social distancing. So when will that type of advice be issued to fully vaccinated Canadians?
So I think from a public health community perspective and in discussion with chief medical officers, I think mask might be the last layer of that multi-layer protection that would advise for people to remove. I think we have to slowly and surely ease the more restrictive measures, those shutdowns and stay-at-home orders. Those are the really key things that we need to really avoid as a community, as a population, and not have a resurgence as soon as you release that. That is the primary objective moving towards the fall. If we get into the we might get 2 doses into arms quicker than the fall, but it's moving into the fall is when you go indoors. And we have to be very careful when we're going indoors. Even with 75% coverage, 25% of people may not be covered. So you actually have to be really careful as you slowly ease those measures. I think the data will direct us as to what to do and when that key moment is. The other thing, and Ms. Hajdu would probably want to comment on this, is that as individuals, of course, we're all different in different circumstances, with different ages, with different underlying medical conditions, and the ability to control our environment. So I think another thing that we're hoping to do is given further guidance to people in terms of risk reduction for their individual assessments. And there is no doubt that even if you are immunocompromised or you're someone who may not be able to mount an immune response, for example, you're going to continue to take a number of measures, including wearing of masks might be, again, as your last layer of measure to be taken off. So we are taking a bit of a different approach to the United States and maybe a little bit more similar to that of the United Kingdom.
Est-ce qu'on peut répéter la réponse en français, s'il vous plaît?
Alors, je pense comme... Oh, well, allez-y, Howard. Go ahead.
Answer to be repeated in French now.
Non, allez-y.
C'est
Go
Dr.
ahead.
New.
It's Dr. New now.
Peut-être pour résumer ce que Dr. Tam
To
a déjà
summarize
constaté. Moi aussi,
what
j'ai
Dr. Tam's
répondu à
already
cette
said.
question.
I
Je pense
answered this question as
avant
well.
que ici au Canada, c'était plus une approche, on me dit,
Here in
collective.
Canada, we have more of a
C'est pas
collective
vraiment une
community
question
approach.
pour un individuel, mais
It's not
qu'est-ce qui se passe
so much an
actuellement dans la
individual
communauté?
question, but what's
Parce
happening
que
in the community.
si on est vacciné, mais on a aussi des
We may be
autres
vaccinated,
peut-être
but
en
others
condition peut-être un système immunitaire
may
affaibli.
have a
C'est
weakened immune
important de
system,
continuer
and so it's
de
important
porter
to
un masque,
continue to
même
wear a
si on
mask,
a reçu même une dose ou
even
deux
if we've
doses de
received
vaccin. Donc,
one
je pense
or
que
two doses of
c'est plus
vaccine.
une question ici au Canada et aussi avec notre infographique, ça
In
démontre
Canada, our
très bien c'est
infographics
quoi peut-être
show
le chemin à faire. Parce que c'est
the way
pas seulement une
forward.
question pour
It's not only
une
a
personne, mais
question
c'est quoi la
for an
couverture
individual,
vaccinale
but
dans
what
une
is the
communauté,
vaccine
mais
coverage
aussi
in
c'est
the
qu'est-ce qui se
community,
passe avec les conditions, les
what's
situations
happening
épidémiologiques.
at
Donc,
the epidemiological
il faut
level.
regarder vraiment les
So we
indicateurs,
need
qu'est-ce
to
qui se
look at
passe
the indicators and
dans
look
la
at what's
communauté,
happening
aussi
in the
dans les
community,
hôpitaux pour le
in
système
the
de soins de
hospitals,
santé,
for the healthcare
avec la
system,
couverture vaccinale.
with
Donc, c'est pas
vaccine
si simple
coverage.
que peut-être
So it's not as
comparé aux
simple
États-Unis
as
de
comparing
se demander,
ourselves
OK,
to the United
qu'est-ce qu'on peut
States
faire?
and
Est-ce qu'on
saying,
peut
what
enlever
can
le
we do?
masque avec une
Can we
dose ou
stop
deux
wearing
doses de
masks
vaccin?
with one or
Merci.
two doses of vaccine?
Okay, we'll
Thank you.
take the next question, please.
Thank you. Merci. Our next question. La prochaine question. Laurence Martin, Radio-Canada. Votre ligne est ouverte. Your line is open.
Oui, bonjour.
Question.
Je me
Hello.
demandais donc pour votre objectif premier,
For
là, qui est
your
de
goal
75% des
that
Canadiens qui ont reçu une
75% of
première
Canadians
dose,
having received a
20%
first
qui
dose,
ont reçu une
20%
deuxième
having
dose.
received a second
Quand
dose,
est-ce que vous pensez que c'est réaliste
when
de
do you think it's
franchir cette
realistic that
étape-là
we'll
avec
hit those
la
marks
progression de la vaccination que vous
with
voyez en ce
the
moment,
vaccine
les
rollout you're
livraisons qui
seeing
arrivent,
now, with deliveries
fin
arriving
juin, début
end of
juillet,
June,
fin
early
juillet? Est-ce que vous pouvez nous
July,
donner une date un peu plus
early
concrète?
July, end of July? Could you give us a more concrete date, please?
C'est Dr. New. Juste pour Mr.
Answer,
Leblanc,
Dr.
peut-être
New.
pour commencer. Mais moi, je
Now,
peux dire avec
I can
qu'est-ce
say
qui se passe à l'heure actuelle aussi
that with
avec
what's
les
happening currently
livraisons
with
des doses de
deliveries
vaccins aux
of
provinces
vaccine
et
doses to
territoires.
the
Je
provinces and
pense qu'on est
territories,
dans une bonne
I
position
think
pour
we're well
offrir
positioned
tous les Canadiens
to offer
éligibles pour un
all
vaccin.
eligible
Je
Canadians a
pense que d'ici
vaccine
la fin de juin,
by the
c'est
end of
en
June,
effet le début d'été. Donc,
so the
je
beginning
pense
of
que ça,
summer.
c'est pour la première étape pour offrir au moins
I think that's
une
the
dose de
first step
vaccin à tous
to
les
offer a
Canadiens
dose of vaccine to all
admissibles. Et pour
eligible
la deuxième
Canadians.
dose, je pense que c'est
And
vraiment
for the
ça
second
dépend
dose,
dans chaque province et territoire,
it depends. Each
le
province and
déploiement du vaccin
territories
dans leur propre programme de
have their own
vaccination. Je pense
vaccine
que c'est
rollout.
toujours une priorité pour
It's a
offrir
priority
la
to offer
deuxième
that
dose
second
aux
dose
groupes prioritaires
to priority
comme les
groups
aînés et aussi
like
les personnes à
seniors
risque
and
des
at-risk
conséquences
people,
graves, aussi le décès avec la COVID-19.
those who are
Et au
vulnerable
fur
to
et à
dying
mesure,
of
je pense
COVID-19.
qu'on va aussi offrir aux autres
And
groupes prioritaires.
then we'll
Donc,
be
pour la
extending it to
deuxième
other
dose,
priority groups.
on
So for the
espère
second
que
dose,
aussi pour offrir la deuxième
we
dose
hope
à
we
tous les
can
Canadiens,
offer a
peut-être une
second
couverture
dose to all
vaccinale de
Canadians
75%
and have
aussi
that vaccine coverage of
à la fin
75%
du mois de septembre.
at the end of
En effet, aussi
September,
le début d'automne.
the beginning of the fall.
Si vous me permettez aussi, Laurence,
Minister LeBlanc,
nous sommes
if I may,
énormément confiants
we are very
de
confident
la capacité des
in the
provinces de
province's
livrer
capacity
les doses de
to deliver
vaccins. Nous avons
vaccine
vu
doses
depuis déjà plusieurs
for a
semaines
number of
les
weeks.
provinces
We've seen the
augmenter une
provinces
capacité
increase
efficace
capacity
afin de livrer les vaccins
to deliver
vers les
vaccines
populations ciblées et de plus en plus vers
to
leur
groups that have
population
been
générale.
chosen and then the
Alors,
general
comme le
public,
docteur New, je pense, a bien indiqué, et
as
comme le
Dr.
Premier
New
ministre et Mme
indicated
Anand
well, as the
ont
Prime
dit
Minister
depuis
and
déjà
Minister
plusieurs
Anand have
semaines,
been saying for a
nous
number
sommes
of weeks,
confiants
we are
qu'avant la fin
confident
juin,
that before the end of
tous les
June,
Canadiens
all
qui aimeront avoir
Canadians
une
who
première dose
want
de
a
vaccin
first
pourront
vaccine
être
dose
vaccinés. On
will
espère
have
que
it.
ce sera à 75%,
We hope it'll be
sinon plus.
75%, if not
Et
higher.
on connaît déjà des groupes prioritaires,
And
que
we
ce
know
soit
which
des
priority
professionnels de
groups there
santé,
are,
entre autres,
like
qui ont eu
healthcare
des fois des
professionals
deuxièmes doses,
who've
et les
sometimes
provinces
had a
vont
second
acheminer les
dose, and
deuxièmes doses
provinces
vers, comme le
will be
docteur New a dit,
sending these
ces
second
groupes
doses to these
prioritaires.
priority
Mais au
groups.
courant de l'été, avec
But over the
l'augmentation
summer,
impressionnante
with the
de
significant
vaccins qui
increase
vont
in
arriver au
vaccines
Canada, comme
arriving in
Anita Anand
Canada,
a bien indiqué,
as
nous
Minister
sommes tout à fait
Anand
confiants
indicated,
que les
we are
deuxièmes
very
doses pourront
confident
être
that second
administrées
doses
au courant
will
des mois
be
de l'été et
administered over
peut-être
the
au mois de
summer
septembre,
and
comme
perhaps in
le docteur New
September,
a indiqué.
as
Alors,
Dr.
nous
New
sommes
said.
tout à fait confiants qu'on est
So we are
sur
very
l'échéancier
confident that we're on
qu'on a
track,
décrit déjà depuis plusieurs semaines.
as we've described for a number of weeks.
Suivi, Laurence?
And I
Follow-up
will
question,
wait.
Laurence.
Sorry, I'll let Minister Anand come in.
Well, and if perhaps Minister Anand can say, my question was about the 20, and that's not my second question, but my question was really about like that 20% of second dose when it's realistic to get that so that we can go through this really first step that you guys mentioned earlier today.
Well,
So, this
so
is Theresa
from a
Tam. Maybe I
procurement
can be more precise. I know that provinces and territories are already going back to administer the second doses. So long-term care facility, for example, I've been told that the majority of them are already getting their second doses. And then, of course, the healthcare workers and Indigenous communities that were the initial cohorts. And so that's already happening. And why 20%? Well, 20% is a calculation on some of those highest risk groups. And by having them already getting their 2 doses, then you stand to lift those measures without overwhelming your ICUs and some of your hospital systems. While we're talking about the second dose, it is very important to get the second dose. But I just want to reassure people, because we have had a lot of questions about that interval, that dose interval. And you may have seen one of the studies coming out of the United Kingdom, which shows that even for seniors, these are over 80-year-olds who got the Pfizer vaccine, mounted a much stronger antibody response, 3.5 times stronger, when the interval was stretched and the second dose was delayed to 12 weeks compared to the 3 weeks. So I think for the people who are anxiously waiting for their second dose, I think that Canada and in following, I think all the provinces following the advice of the National Advisory Committee on Immunization, I think did a very smart strategy.
Minister Anand?
I would like to just underscore that this discussion is possible because of the increasing supply that is continuing to come into this country. Next week alone, Pfizer will be advancing another 1.4 million from the week after to accommodate the long weekend, in addition to the originally scheduled 2 million doses. So combined with the 1.1 million doses of Moderna that we expect to receive next week, also, we are going to see 4.5 million doses coming into this country next week alone, which is unprecedented in terms of our vaccine deliveries. It's as a result of our diverse portfolio of vaccines and the increasing ramp up in the millions of doses coming into this country that we can have this conversation about the supply and what that means for all Canadians. And for the federal government's part, we will continue to bring in millions and millions of doses into this country to support the provinces and territories in their inoculation efforts. Thank you.
Doctor, maybe I could just add
sorry to interrupt. I just wanted to re-emphasize what Dr. Tam said, because I think it's so important. You know, Canada pursued a 2-dose strategy that had a delay between the first and second dose. And we know that there's been a lot of commentary about that. And, you know, many Canadians wondering what that meant for their health outcomes. And I think it's really important to reiterate that the science is finding that that delay is actually helping people mount even stronger immune response. And so, you know, this is what was the underpinning of NACI's recommendation, both to save lives and based on, you know, data and historical knowledge of how vaccination works, that in fact, by delaying that second dose, that it would not impair people's ability to mount an immune response. And in fact, what the research is showing that is that it creates even a stronger response because of that extended delay. I think that is good news for Canadians who have been very patient and who have contributed so much across the country to making sure that everyone can get that first dose in their community. And I think it's another opportunity to say thank you to the Canadians that have come along with us on this approach that, yes, does differ than our American cousins, but is much similar to the UK approach. And so perhaps, Dominic, you might want to repeat some of that in French.
Est-ce que je peux juste poser ma question de suivi, juste pour qu'on...
May I ask my follow-up question?
Allez-y, Laurence.
Oui,
juste ma question de suivi. Oui, parfait. Ce serait pour vous d'ailleurs,
yes,
M. Leblanc.
It would be for you, Minister Leblanc.
Par rapport au plan de déconfinement, bon, je comprends que vous donnez des orientations aujourd'hui, mais que ce sont les provinces qui ultimement décident quand elles vont déconfiner et comment. On a vu après la deuxième vague, les provinces qui ont déconfiné assez vite,
provinces that opened up pretty quickly
vague au Québec, en Ontario.
Led us into a third wave in Quebec and Ontario. Do you fear that this time, once again, the provinces will open up too quickly?
Merci, Laurence. Moi, je peux offrir quelques commentaires et ensuite, si le Dr. New aimerait ajouter ou quelqu'un d'autre, évidemment. Pour reprendre juste ce que Patty Hajdu a dit aussi, je pense que c'est important de souligner en français aussi que la stratégie canadienne de donner une première dose au plus grand nombre de personnes possible, et c'est ça que les provinces ont décidé ultimement de faire, quitte à donner une deuxième dose de vaccin à l'intérieur des délais prescrits, pourra probablement donner une meilleure immunité à la longue aux personnes qui ont reçu ce genre d'immunisation et le délai du deuxième dose. Madame Hajdu a parlé de certaines études qui peuvent confirmer que c'est une stratégie qui risque de donner une bonne et sinon une meilleure immunisation. Alors, nous sommes confiants de ça. Quand ce qui a trait à la question des réouvertures, vous avez raison. Peut-être après la deuxième vague, il y a certaines mesures de santé publique qui ont été enlevées à une vitesse qui a permis, avec l'arrivée des variants, on s'entend, qui a permis peut-être une troisième vague de prendre la relève. Il n'y a pas de doute que le contexte actuel, à cause de l'augmentation du nombre de personnes vaccinées et le respect des mesures de santé publique, les mesures sanitaires telles qu'énumérées par les provinces et les autorités locales, vont faire en sorte, et c'est ça que nous espérons, qu'on peut éviter une autre vague aussi difficile que la troisième vague qu'on voit présentement. Mais le premier ministre a été très clair cette semaine, la Dr. Tam, le Dr. New, tout le monde, que c'est important de garder les mesures sanitaires en place suffisamment longtemps pour vraiment permettre à la courbe de diminuer, permettre en même temps le nombre de vaccinations à augmenter. Et c'est ça le travail que nous faisons en partenariat avec les provinces. La discussion entre les ministres du gouvernement fédéral, nos homologues dans les provinces et les territoires et au niveau des dirigeants de la santé publique comme la Dr. Tam et le Dr. New font en sorte qu'on essaie de trouver une façon nationale
allow
de
us to
donner
look
le
for
même
a national
message aux
approach
Canadiens
to give
quant à
Canadians the
qu'est-ce qu'on
same
peut faire
message
cet
in
été,
terms
qu'est-ce
of
qu'on
what we
pourra
can
faire
do
cet
this
automne,
summer, what we will be
et
able to do this
surtout à
fall,
indiquer aux gens
and especially
les
tell
possibilités de
people
voir une réouverture
about the opportunity
économique
to have
sécuritaire,
a safe,
mesurée, mais
measured,
fiable. Et c'est le
reliable
travail qu'on
economic
est en train de
recovery
faire avec
and
les provinces et
reopening.
les
So that's
territoires,
the
et
work
nous
we're
allons
doing with the
continuer
provinces and
de
territories.
travailler
And we will
d'une façon
continue
assez
to work
étroite pour
closely
s'assurer qu'on fasse ça dans une
to ensure
mesure
we do this
coordonnée
in a
et cohérente.
coordinated, coherent fashion.
Merci, c'est Dr. New.
Thank you, Dr. New
Peut-être
here.
je peux seulement souligner un autre point que le ministre
I'd like
Hajdu
to
a fait,
highlight
et c'est
another
vraiment
point from Minister
reconnaître,
Hajdu, and it's really
d'après
to
moi, le bon
recognize
travail de
the good
notre
work
comité consultatif
by
national
our
de l'immunisation.
National
Ils ont
Advisory
vraiment analysé les données
Consultation Group
probantes.
on
Ils
immunization.
ont
They've really
aussi
looked at the evidence.
comme reconnu les principes d'immunologie et
They've
vaccination.
recognized the principles of
Et
immunology
c'est
and
pourquoi ils ont
vaccination,
fait leur
and that's
recommandation
why
pour
they've made their
peut-être allonger
recommendation
l'intervalle entre
to
les deux
stretch
doses
the interval between the two doses.
des vaccins. Donc, maintenant, on voit maintenant avec qu'est-ce qui se
So
passe
now we
avec les
see
essais cliniques,
with
les
what's
résultats,
happened with clinical
qu'est-ce qui se
trials
passe
and
au
results,
Royaume-Uni.
what's
Et on
happened
voit
in the
que
United
Dr. Tam aussi a
Kingdom. And
constaté
as Dr. Tam
qu'on a
said,
comparé c'est quoi
we've
comme
compared
la réponse peut-être
the immune
immunitaire,
response
peut-être niveau des anticorps
in terms of
pour les personnes
antibodies
qui ont
for
reçu la
people who
deuxième dose
received a
après 3
second dose
semaines et
after
après
3
12
weeks
semaines. Et on
or
voit que
12 weeks.
même le niveau des anticorps,
And
le
the
système
antibody
immunitaire,
level,
c'est
the
3
immune
fois
system,
plus fort
is 3
peut-être
times stronger
pour les personnes qui ont reçu
for
la
those who
deuxième dose
received the
après
second
12
dose
semaines
12
comparé à
weeks
les
later
autres qui ont
compared to
reçu
those who received
après
it
3 semaines.
3
Donc,
weeks later.
et c'est très important de
So it's
continuer
very important to continue
de respecter l'évolution de la science, c'est
to
toujours
continue to follow the
d'analyser,
science
suivre aussi qu'est-ce qui se passe
and
avec les données
analyze
probantes.
what's happening with the
Merci.
evidence. Thank you.
Okay, we'll take one last question on the phone. Nous allons prendre la dernière question. Merci.
Thank you. Merci. Our last question, la dernière question, Stephanie Levitz, Toronto Star. Your line is open. À vous la parole.
Hi, thank you. I'm going to go back to a question that my colleague Kevin asked about what isn't and isn't on these guidelines released today. I mean, is this the best we could do? Is this the best we can give people hope and encouragement about why they should get just even a single dose of a vaccine, never mind two?
Maybe I can start and then turn to the doctors. Well, first of all, thank you for the question. And I think the short answer is the best reason that someone should get vaccinated is to save their own life, to protect themselves from COVID-19, and to stop the spread to their family and their community. That is the best reason to get vaccinated. It will save your life. It will stop the spread in your community. It will protect your family. It will protect your colleagues. But of course, we wanted to also give people an indication of what increasing vaccination in the country and in communities would look like, and what kind of activities we could anticipate would be returning to our everyday lives as a result of increasing vaccination. And of course, we are a federation, which means that provinces and territories have dramatically different healthcare systems. They have different epidemiology. COVID is, in some cases, even right now, significantly surging in some regions. In other regions, there is very little COVID. So it is hard to have a national guidance that gets at the specific nature of COVID-19 in particular regions. But this is a roadmap for Canadians. This gives Canadians a vision of what it looks like as we proceed down this vaccination path together, what kinds of activities we can anticipate we can enjoy without worrying about either catching COVID or transmitting COVID. And certainly, I think it helps provide that guideline for Canadians as they undergo their own communities' journey with vaccination. So I think for me, this is an important step forward. It does provide a unified vision for the country, but allows for that local public epidemiology, how much COVID is in a community, how much vaccination has occurred within a community, and those variables are important. And that's why the companion piece online really gives Canadians an indication of those kinds of metrics that they can follow along for a more specific understanding of their own region's risk factors. Dr. Tam?
Yes, so these are obviously very broad targets and guidance. And we would look towards providing more specific guidance for individual settings or situations like we have all along, but now with the vaccine on board. So I think that's a different kind of communication. But I think for the general public, I think the key is that vaccines play a really important part. When you only have mostly one dose on board, keep going with all these protective measures, but the outside is great. You can get outside and do lots of things safely. With a view, in the not too distant future, by the way, especially if we can get the second dose covered fast, is that we can then get safely back indoors and do some of the really key things that we've missed doing without a rebound. So I hope, of course, that's only one way of encouraging the public to get vaccinated and still hang on for those public health measures, given that we're not yet down the curve. We've got lots of other ways of communications, as well as, I think, different innovations in providing fundings to local jurisdictions or organizations to get people vaccinated, incentivizing people to get vaccinated in different ways. I think lots more carrots will be good. And just so that I can end by giving a shout out to Peel, Peel region is doing an all night long vaccination clinic, and they're going to have fun things that will keep people be drawn there. But if you got shift work, for example, an all night clinic sounds just the thing that would be quite attractive. So lots and lots of different activities will have to take place to get Canadians to that kind of target. But these general overarching targets, I think, are helpful.
Stephanie, follow-up?
Yeah, just as a follow-up, just because lots of folks are also pointing to this idea of a one-dose summer, two-dose fall, and saying, well, if vaccines are coming online at the rate they're supposed to, ought it not be a one-dose spring and a two-dose summer, and then we're actually back to normal by fall? And I wonder what your assessment is of that. Is that fair for people to think, or are we still too far off from moving up that timeline in a meaningful way?
It's Patty again. I would say that if that is possible, of course, that's the ideal state. And we are working, and I know my colleague, Minister Anand, is working day and night to get vaccines into the country earlier and faster. So this is a target based on our current projections. Of course, it could shift to be an earlier target where we see more people more rapidly vaccinated with a second dose. And if that's a possibility, of course, provinces and territories are eager to pursue that approach as well. But I will say that we remain focused on this as a realistic target, and we will adjust our projections if the situation changes. Anita, would you like to add a few words?
Sure, Patty. I will just mention that work of procurement that Patty just described to accelerate doses to earlier and earlier time periods in this year is exactly what we do at PSPC every day. And as a result of our negotiations that are ongoing with suppliers, we've already accelerated 28 million doses from later quarters to earlier quarters this year. So we will continue to pull in unprecedented numbers of vaccines into this country. As I mentioned, 4.5 million doses alone next week. And we will have, by the end of May, in total, 25 million doses of vaccines brought into this country alone. And so, yes, the vaccine procurements and deliveries are continuing to accelerate. But as my colleague, Minister Hajdu, mentioned, we want to be realistic. And if it turns out that we can adjust, we certainly will do so, but it's important to be realistic in terms of what we are bringing in and what Canadians can expect as a result. Thank you.
Est-ce qu'on peut répéter la réponse en français, s'il vous plaît?
Oui, bien sûr.
Repeat it in French now.
Anita.
Yes, go ahead, Anita.
No, vas-y,
No,
Dominique.
go ahead, Dominic.
Allez-y, Anita.
Go ahead, Anita.
D'accord.
Okay.
comme j'ai déjà dit en
As I've already
anglais,
said in English,
chaque jour, chaque semaine,
every day,
mon
every
département et
week, my
moi
department and I
travaillent pour
are working
accélérer
to
des doses
accelerate
plus
the
tôt dans
delivery
l'année.
of
Déjà,
doses.
nous avons déjà
We've
accéléré
already
plus de
accelerated
28 millions de
over
doses
28 million doses
pour avoir des doses dans
to have
les mois
doses
ici maintenant
in the
et
current
plutôt
months and
de maintenant.
earlier.
Donc, pour la prochaine semaine,
So
nous
over the next week,
aurons, je pense,
we will have
4,5 millions de
4.5
doses
million
pour
doses
la semaine prochaine.
next week.
Et pour le mois de mai, plus
And for the
de
month of May,
25 millions
over
de
25
doses
million doses
auront
will have been
ici au
delivered to
Canada.
Canada.
Donc, ça, c'est un projet, une approche qui est réalistique.
So that's a
Et
realistic
nous
approach,
devons penser de nos
and we
approvisionnements
need to
chaque
think
jour,
of our supply
mais
every day,
c'est important d'être réalistique aussi.
but it's important to be realistic as well.
Ça a mis la fin à la conférence de presse. That's the end of the press conference. Have a great weekend, everyone.
Merci beaucoup. Bonne fin de semaine.
Thank you.